about the adaptive system to assist stroke rehabilitation using wearable sensors and interactive games. So before we get started, we're going to be talking about what a stroke is, the stages of a stroke, the device, specifically the hardware and the gamification part, and finally the methodology, 1 and 2, the results, and of course the future scope. So what is a stroke? Well, every year millions of people worldwide suffer what is called a stroke. It occurs when blood flow to the brain is blocked either by a blood clot or burst blood vessels, and brain cells are deprived of oxygen. Within minutes, those brain cells begin to die, leading to lasting damage. The effects can be devastating, and up to 80% of stroke survivors are left with weakness, stiffness, or loss of coordination in their hands and arms. That means even simple to daily tasks like eating, dressing, or writing can suddenly become incredibly difficult. Recovery is often a long road. Research shows that only a small percentage of survivors regain full motor function in the first 6 months after their stroke. For many, progress is slow and some may continue to experience challenges for years. But there is hope. The brain has an incredible ability to adapt and rewire itself, a process known as neuroplasticity. Early, consistent, and targeted rehabilitation takes advantage of this window of recovery. Repetitive exercises, physical and occupational therapy, and in some cases, new technologies like robotic assisted therapy or virtual reality can help the brain rebuild connections and restore movement. The key is to start therapy as soon as possible and stick with it. Every repetition, every exercise, every small gain matters. With persistence and the right support, many stroke survivors are able to regain independence, rebuild confidence, and return to the activities they love. So, what are the stages of a stroke? Well, stroke recovery doesn't happen all at once, and it happens in stages, specifically 3. Each stage brings its own challenges and opportunities for healing. The acute stage lasts from the moment the stroke happens to the first 24 hours. This is a medical emergency, as during this time, the focus is on restoring blood flow to the brain as quickly as possible, stabilizing the patient, and preventing further damage. Treatments like clot busting medications or surgical procedures can make the difference between life and death. Next comes the subacute stage, which lasts from 24 hours up to 6 months after the stroke. This is the most critical window for rehabilitation, as the brain is the most responsive to change during this period, thanks to neuroplasticity, which is its ability to reorganize and form new connections. Intensive therapy is key here. Physical therapy to regain strength and coordination, occupational therapy to relearn daily skills, and speech therapy if communication was affected. The goal is to take advantage of this recovery window to maximize function. Finally, we enter the chronic stage, which begins 6 months after the stroke. Progress may be slow, but recovery doesn't stop. This stage is about maintaining gains, preventing complications, and continuing to build strength and independence over the long term. Many survivors keep improving months or even years after their stroke with consistent exercise, therapy, and support. Understanding these stages is crucial because right care at the right time can change the entire course of recovery. Now let's take a closer look at what's happening inside the brain during each stage. In the hyperacute phase, the biggest concern is cell death, which is the brain tissue is being starved of oxygen, and in hemorrhagic strokes, there's also the risk of hematoma expansion. This is why rapid treatment is so crucial. As you move into the acute phase, inflammation and scarring peak. The brain is actively responding to the injury, which is why preventing complications like swelling or infection is a top priority during this time. In the early subacute phase, we see a rise in what's called endogenous plasticity, the brain's natural ability to reorganize and form new pathways. This is when intensive repetitive rehabilitation exercises are most effective because the brain is primed to relearn lost functions. Then, in the late subacute phase, we see gradual but steady improvements in functions as therapy continues to build on those new neural connections. Even in the chronic stage, more than 6 months after stroke, we still see ongoing improvement. It might be slower, but function can keep improving for months or even years with consistent effort. So what's the problem? Well, the financial impact of strokes is significant, and in the United States alone, stroke-related costs are estimated at $56.2 billion between 2019 and 2020. And with aging populations worldwide, the number of stroke survivors is expected to rise, creating even more pressure on healthcare systems and caregivers. To address these challenges, researchers have explored multiple rehabilitation strategies. 1. Robotic rehabilitation devices and brain-computer interfaces can provide passive or semi-active movement training, which is helpful for severely affected patients. But these systems are expensive, clinic-based, and require close supervision, limiting accessibility. Rhythm and music-based therapies, like rhythmic auditory stimulation and music-supported therapy, have been shown to promote neuroplasticity and improve motor function. However, they rely on trained therapists and are difficult to implement consistently at home. Lastly, game-based rehabilitation frameworks have emerged as a way to increase motivation by turning therapy into an interactive experience. Many of these systems, however, rely on bulky motion capture hardware or full body setups, making them costly and less practical for home use. Well, what is our device? Well, Rehab Reach offers an innovative solution, a smart wearable rehabilitation device paired with an interactive piano-based game designed specifically for stroke recovery. The wearable tracks finger movements in real time and connects to a gamified rhythm system that adjusts difficulty based on the patient's ability. Instead of monotonous exercises, patients engage in fun, music-based activities that encourage repetition and promote neuroplasticity. This approach directly tackles two of the biggest barriers to recovery: low engagement and limited access. By turning therapy into a game, patients are more motivated to stick with their recovery routine. And because the device is portable and affordable, it can be used at home, giving patients more control over their progress. Now let's dive into the hardware. Well, our rehabilitation device was intentionally designed to prioritize both functionality and patient comfort. The base structure features a natural curvature that closely follows the anatomy of the human hand. This ensures the device feels comfortable even during prolonged sessions and maintains proper alignment of the fingers for accurate motion tracking. Integrated mounting points allow finger modules to be easily attached and adjusted, accommodating a wide range of hand sizes and levels of impairment. This modular approach also makes the device easy to repair or upgrade without replacing the entire system. Comfort was another major consideration. We included ventilation grooves to improve airflow and keep the hand cool during extended use. Contoured padding zones were strategically placed to reduce pressure on sensitive areas, preventing discomfort or skin irritation. The strap guides and snap fit enclosures hold the device securely in place so users can perform repetitive exercises with confidence that the device will not slip or shift. The device was also fully 3D printed using TPU or thermoplastic polyurethane, a material chosen for its unique combination of flexibility, durability, and comfort. TPU allows the frame to flex slightly with the user's natural hand movements, reducing strain while still providing enough strength to withstand daily use. To enhance stability, key structural components are printed with increased thickness, ensuring the device could withstand the mechanical stresses of therapy session without deforming. At the same time, the overall configuration was carefully optimized to be more compact and lightweight, reducing bulk and making it less intrusive. This compact design is especially important for patients who may already have limited mobility and need a device that does not restrict their movement further. Together, these design choices result in a solution that is ergonomic, durable, and accessible. By leveraging 3D printing, we were able to rapidly prototype, test, and iterate the design, making continuous improvements until we reached a version that balanced comfort, functionality, and cost effectiveness. The result is a wearable device that supports consistent rehabilitation, encourages patient engagement, and is practical for both clinical and home use. Now let's dive into the gamification. The process begins with the patient wearing the device on their hand. Each finger is equipped with a flex sensor that measures the degree of bend during movement. These sensors generate analog voltage signals that are sent to an Arduino-based microcontroller. Using its analog to digital converter, known as an ADC, the microcontroller converts the analog data into a digital signal, ensuring precise capture of finger flexation and extension in real time. Once digitized, the data is transmitted wirelessly via Bluetooth Low Energy (BLE) to a tablet or computer running our rehabilitation application. BLE was chosen for its low latency and low power performance, which are critical for wearable devices. For clinical or developmental environments, the system also supports a UART wired connection, allowing reliable data transfer over USB. This dual communication setup ensures flexibility. At the software level, our system includes two critical code modules. The first handles sensor to keyboard mapping, translating finger flex events into virtual key presses. When a flex sensor's voltage drops below a defined trigger threshold, the system interprets it as a key press, sends a signal through the keyboard library, and marks the key as down. When the finger straightens and the voltage rises above the reset threshold, the key is marked as up to prevent duplicate inputs. This ensures smooth, real-time translation of hand movement into game controls. The final component is the piano game application developed in Unity for cross-platform compatibility and real-time visual feedback. Each finger is mapped to a virtual piano key. When a flex sensor triggers, the corresponding key is highlighted on a screen, and a musical note is played. The game presents rhythm-based challenges where users must press keys in sync with visual and auditory cues, promoting coordination and motor control. Importantly, the game is adaptive. It monitors user performance, accuracy, reaction time, and number of repetitions, and automatically adjusts difficulty to maintain an optimal challenge level. Progress is logged after every session, allowing patients and therapists to track improvement over time. This feedback loop transformed rehabilitation from a passive exercise to an interactive, rewarding experience. To better understand the value of our project, it is important to look at current methodologies used in stroke rehabilitation. One widely used approach is the integration of robotic devices, brain-computer interfaces, BCIs, and non-invasive brain stimulators. Robotic devices such as exoskeletons and end effector systems assist patients in performing repetitive motor tasks that are crucial for neuroplasticity. BCIs translate brain signals into control commands, providing real-time feedback and encouraging active participation. Non-invasive brain stimulators like TDCS and RTMS are often used to modulate cortical excitability and promote motor recovery. However, while these systems are effective, they come with significant drawbacks such as they often require expensive equipment, highly trained clinical supervision, and extended setup time, which can lead to patient fatigue and disengagement over time. Another methodology focuses on rhythm and music-based interventions, such as rhythmic auditory stimulations, RAS, and music-supported therapy, MST. These techniques leverage the natural coupling between auditory and motor systems in the brain. For instance, rhythmic cues can entrain movement patterns, improving timing, pacing, and coordination. Patients might practice by playing simple instruments or synchronizing movement to a beat. Studies have shown that these interventions are particularly effective for stroke and Parkinson's patients. But again, these methods have limitations. They are typically require access to trained music therapists, controlled environments, and in-person sessions, making them less accessible for home rehabilitation. A third major category is game-based rehabilitation systems, which aim to increase patient motivation and adherence to therapy by turning repetitive exercises into interactive games. These systems often use motion tracking technology, biosignal monitoring, and remote databases to measure progress over time. Game-based therapy applies principles like adaptive difficulty, feedback loops, and goal setting to keep patients engaged. Now, for our first experiment, our primary goal was to evaluate the accuracy and reliability of our device in detecting finger movements, a critical factor for application in stroke rehabilitation and other fine motor therapy exercises. We designed a structured testing protocol to systematically quantify performance, ensuring that our results would be meaningful and reproducible. The experimental setup involved a controlled series of 50 flex release cycles per finger for each participant, with all data captured and logged in real time via a UART interface. This allowed us to collect high-resolution movement data, including the timing and sequence of each detected press and release, and to analyze performance across multiple fingers individually. By standardizing the number of repetitions and the conditions under which they were performed, we aim to reduce variability due to fatigue, positioning, and other external factors. Our results were highly encouraging. Across all 4 fingers tested, the index, middle, ring, and pinky, the device achieves an average detection rate of 97%, demonstrating that the system can reliably sense and respond to intended finger movements. Among the individual fingers, the middle finger achieved the perfect detection, with all 50 flex release cycles correctly identified and no false positives recorded. The index and pinky fingers exhibited nearly perfect performance, each missing only 1 or 2 cycles and generating a single false positive each. The ring finger displayed slightly lower accuracy, with 3 missed cycles and 2 false positives. This is likely attributable to anatomical factors. The ring finger typically exhibits less independent movement compared to the other fingers, which can make it challenging for the sensors to distinguish intentional movements from minor adjacent finger shifts. While the overall performance was promising, a few sources of errors were identified. Minor inaccuracies were primarily caused by slight variations in sensor placement, which can affect the sensitivity and orientation of the device. Additionally, small unintended finger movements occasionally triggered false positives. These errors, while minimal, highlight opportunities for refinement in future iterations of the system. To address these issues and further enhance accuracy, we plan to implement a more robust calibration process that accounts for individual finger dimensions and movement patterns. In addition, incorporating dip bounce logic will help filter out micro movements and transient signals, reducing the likelihood of false positives without compromising real-time responsiveness. Even with these small errors observed, our findings indicate that the device is highly reliable and suitable for stroke rehabilitation applications. In this context, the emphasis is on the consistent repetition and the ability to track overall progress rather than the perfect detection of each individual press. The high accuracy achieved, combined with immediate feedback and ease of use, suggests that the system has strong potential to support patients in regaining motor function, improve engagement with therapy exercises, and ultimately accelerate recovery outcomes. Our second experiment, the goal of this study was to assess long-term user engagement with a gamified rehabilitation system, examining whether integrating game elements and music into therapy could enhance participation, motivation, and performance. We conducted a 10-day trial with 5 participants, each using the system for approximately 15 minutes per day. During each session, we tracked key metrics including session count, session duration, user satisfaction, and performance metrics such as accuracy and speed of finger movements. The system incorporated adaptive difficulty and music-based game elements designed to make therapy more interactive and engaging. Over the course of the trial, participants demonstrated clear improvements in engagement and performance. Average session duration increased from 15 minutes at the start of the trial to 20 minutes by the end. Satisfaction scores also showed a positive trend, rising from an average of 4.2 to 4.7, suggesting that participants found the system increasingly enjoyable and motivating. Performance metrics indicated that both the accuracy and speed improved over time, reflecting not only adaptation to the game environment, but also measurable progress in motor control. The use of adaptive game difficulty played a key role in maintaining motivation, providing just enough challenge to keep participants engaged without causing frustration. The combination of gamification and music-based therapy was reported to be both stimulating and enjoyable, helping to reduce boredom that can accompany repetitive exercises. Overall, these studies suggest that gamified rehabilitation promotes more consistent practice and has a potential to yield better rehabilitation outcomes compared to traditional exercise routines by keeping users engaged, motivated, and focused on improvement. So to highlight our 2 key results, we achieved a mean detection rate of 97% and a satisfactory score at the end of the 10 days of 4.7 out of 5. So there are several avenues to further enhance the current system, making it more robust, scalable, and clinically relevant. One key direction is expanding the platform beyond hand and finger therapy to include arm, shoulder, and even lower limb rehabilitation. This would allow the system to address a wider range of stroke-related impairments and serve patients with varying levels of mobility and functional deficits. Integrating machine learning algorithms could significantly improve adaptability and personalization. For example, the system could automatically calibrate sensors based on each patient's movement patterns while dynamically adjusting difficulty and sensitivity in real time as a patient progresses. This would create a continuously tailored rehabilitation experience, optimizing challenge and engagement while minimizing frustration or fatigue. Connectivity is another area with substantial potential. By leveraging cloud services or Wi-Fi, therapists could remotely monitor patient performance, provide real-time feedback, and update therapy plans without requiring in-person sessions. This approach could increase accessibility to high-quality rehabilitation for patients in remote or underserved areas, while also enabling continuous tracking of progress over time. Incorporating soft wearable technologies such as stretchable or textile-based sensors would enhance comfort, usability, and durability. These improvements would make it easier for patients to use the device for longer sessions or throughout daily routine, which is critical for maximizing the frequency and effectiveness of therapy. By combining these enhancements, expanded therapeutic coverage, intelligent adaptation through machine learning, remote connectivity, and wearable comfort, the system could evolve into a comprehensive tele-rehabilitation platform. Such a platform would not only support long-term recovery, but also make rehabilitation more accessible, engaging, and effective for a larger population of stroke survivors, ultimately promoting better functional outcomes and improved quality of life. Thank you.